Patient showed up in my office about 8, 9 years ago and said my back pain got better from reading this book. Now these same people come in and I'd be like, really? Been at Johns Hopkins and Mayo Clinic and seen all these doctors and all these, and you're not better? That's fantastic. That means the problem's in your nervous system, and I know what to do about that.
There's unfortunately no treatment. Chronic symptoms are just something that you're going to have to live with. That's the message that so many people hear in their doctor's offices. But what we rarely hear is how the doctors themselves feel when they've done everything by the book, everything they were trained to do, and their patients are still suffering. After decades practicing internal medicine, Dr. Brad Fanestil hit that exact wall. He was successfully treating everything from acute infections to ICU level emergencies. But when it came to patients with chronic pain and unexplained symptoms, nothing seemed to help. And for Dr. Fanestil, watching them continue to suffer was heartbreaking. If you're new here, I'm Raelan Agle, and on this channel, no one's going to tell you that recovery is impossible because we know that's simply not true. If you or someone you care about is facing something like long COVID or chronic fatigue syndrome, you are in exactly the right place. Recovery science is evolving fast. And we're here on this channel to close that information gap, bringing you the real-time insights, the newest research, practical tools, and powerful stories of transformation. Today, right now, I'm so thrilled to introduce you to Dr. Brad Fanestil, joining us from Boulder, Colorado. After years of seeing his chronic pain patients struggle, he began diving into the latest neuroscience, research backed by functional MRI data, showing the link between emotions and symptoms. And once he brought those insights into his practice, things started to change. His patients finally began to improve. I am so excited that he's here to share how this new understanding is reshaping medicine and how it could be the missing piece in your recovery journey as well. Dr. Fanestil, so exciting to have you here. Thanks for being with us.
Oh, thanks for having me. I love talking about this stuff.
Me too. I said I promised to try and not keep you here all day. There's so many great questions and so much information that I want to ask about between your professional experience and all your practice insights. But first, I'm always curious because people like myself who face conditions such as chronic fatigue syndrome or long COVID or any of these more complex or unexplainable symptoms quite often find themselves in doctor's offices where the doctor just really isn't sure what to do with this person. And so what prompted you to shift over into this space that many physicians are not focusing on?
I think for a long time in my career as just a general internal medicine doctor, very traditional, going to the hospital every day, seeing patients, going to my office. I recognized fairly early on that these people with fibromyalgia, chronic fatigue, there was some other story than they're making it up, or there's some ulterior motive, or it's in your head. That just didn't make any sense to me. I had sometimes known these people for years before it happened. And I'm like, that's just not what's happening here. And so I recognize it as something real. I just didn't have a story other than, should we adjust your antidepressant? Or because that can help sleep, let's try that. Or I had my toolkit of pills. So when I'll tell you what, the reason I got into this really is because a patient showed up in my office about 8, 9 years ago and said my back pain got better from reading this book. And of course, it was a John Sarno book. And I said, I read something by that guy 15 years ago. It's in my basement. I know right where it is, but I was busy at that time. 3 little kids, busy practice. I didn't have time. He's on to something, but what am I going to do with that? Well, now I had more time in my life, and I thought, I'm going to read that anyway. I read that, led me to the internet search, led me to a class in Santa Cruz in I think 2018, taught by Alan Gordon and Howard Schubner. And I went to the weekend retreat there, and there were 25 people in the class. And I remember Howard looking around and going, hey, we have 3 MDs in the class. We've been doing this class for 3 years. It's the first time we have any MDs. So anyway, I went to that. I came back and I thought, holy crap, this explains 5 people a day in my practice.
Wow.
And then I had some very good success very early, just with my rudimentary understanding after that weekend. I saw a couple of sort of miracle cures, not of a chronic fatigue yet, but of some chronic pain. And I just said, I remember I remember walking into the back room. I was after I saw this patient that everybody in my office knew, all the other docs knew this guy who was on narcotics, back pain for years. And I said, if this guy ever gets better using these new tools, these new mind body tools, I'm quitting and I'm going to go do this mind body stuff. And sure enough, 4 months later, 6 months maybe, this guy walked in, he's off narcotics, his back pain's gone, he's back into life. And at that point, I'm like, well, I said I was going to do it. I'm out of here. So,
Wow. It's something that we don't think about a lot. We, of course, here on the channel, I'm talking to patients, not my own, but people who have been patients with chronic illnesses and what it's like to go from doctor to doctor and be either dismissed or the doctor has nothing for them. But we don't think much about like, what was it like for you the years leading up to that, seeing all of these patients and being like, I've got all the training. But I can't help you. What was that? What's the experience of that like
yeah,
as a physician?
the experience was crap rolls downhill. And by that, in the medical field, and by that I mean it comes back to the primary care doc. So for years, I saw people who'd come in and go, I've been to Mayo Clinic, I've been to Johns Hopkins, I've seen 13 neurologists and 25 rheumatologists and 17 physical therapists and 2 orthopedists, and I've had 13 MRIs, and I've had scopes and tubes in every orifice, blah, 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 blah. And my response used to be, I mean, I hope I was somewhat compassionate and caring about this, but and again, well, let's see, what can we tweak here? But my real feeling underneath was, what the hell am I going to do about this?
Yeah.
I've seen every specialist in the world. I mean, I'm just a primary care doc. I don't know. And then when I learned that there's a whole different narrative, an entirely different way of explaining what's going on, and an entirely different toolkit, now these same people come in and I'd be like, really? Been at Johns Hopkins and Mayo Clinic and seen all these doctors and all these, and you're not better? That's fantastic. That means the problem's in your nervous system, and I know what to do about that. So
That
just
is incredible.
yeah, it's
It's
just a,
almost like, thank you for doing all of that work of ruling everything out. So now I found you here in my office
yes.
and we know what to do.
Right, and that's an important part, that due diligence part. I
Yeah.
never want to take off a 30-year internal medicine hat and tell somebody, oh, let's do some mind body for that whatever you've got, and I find out 3 months
Right.
later cancer. I mean, it's
Right.
very important to do, and Western medicine's very good at due diligence. We're very good at making sure you don't have something that's killing you. You
Hmm.
feel like it's killing you, but generally, when we tell you it's not, we're usually right. I've seen misdiagnoses many times in my career. I've missed some diagnoses, but I have not seen a missed diagnosis go on for years. That I haven't seen. We find bad stuff gets worse as a general rule. And if your problem's been going on for 6 months, 6 years, almost certainly it's in the nervous system.
And I appreciate you explaining the experience of being a doctor going through this prior to having this knowledge and saying how shit runs downhill. Because I imagine that's also very validating for people listening. Because then think one step further. You're like, if all these specialists and my primary care doctor, who I rely on for everything, don't know what to do, now it's on me. Like, how am I supposed to solve this? I haven't even been to medical school. So it can be very overwhelming. Yeah, for everyone involved.
Frustrating for the doctor, way more frustrating for the patient. But yeah, these are
Yeah.
people who are frustrated.
Yeah.
I joke now that now I only treat all the people I used to not want to see. And now I'm like, get in here.
Oh, I love this so much.
Yeah, it's fun. It's exciting.
Oh yeah, I've heard doctors, or I actually interviewed someone whose brother was a doctor, and he said I wouldn't even mention chronic fatigue syndrome when you go into a doctor's office because they're just going to want to wash their hands of you, like come at it from a different angle, and so it's great to hear that that is changing. And then, so of course, many of us layman folks are not up to speed on mind body medicine, and people start hearing about it and it sounds made up or it sounds like woo. And I get a lot of questions like, where are the studies to back this up? Where is the science if this is a real thing? And this is something that you are, very read up on. So, could you tell us a bit about that? Because this isn't something you made up. This is backed in
No,
research.
after that weekend retreat with Alan Gordon and Howard Schubner, then I just dove into this and I took classes with James Gordon, who is a psychiatrist at the Center for Mind Body Medicine in Washington, D.C. He's published a lot of stuff about mind body tools mostly for PTSD in war torn areas, whether that's Gaza or Kosovo, or he went to Sandy Hook after the school shooting there, and did some other. Anyway, took some classes from him. It sort of broadened my awareness or understanding of all the tools available here. I took some classes with Judd Brewer, who's at Brown. He was at Yale, now at Brown, I think. It doesn't matter where. He's one of these guys with too many letters after his name, PhD, MD, who talks about using these tools mostly for anxiety. He's a psychiatrist. And anyway, various other classes that have really sort of given me a broader understanding of what I think, how mind and body are connected. So I think it's important for people to understand that and let me just use the example of pain here, because it's such a discrete entity, and we can talk about how that this applies also to all sorts of other symptoms, including, of course, fatigue. But the old neuroscience was that your body sent your brain a pain signal. And your brain said, thank you for that pain signal. I will go get my Advil or my heating pad. The new neuroscience, and by the way, the reason we have a new neuroscience is largely because of an imaging tool called functional MRI or fMRI. Also EEG, there's other stuff. But with functional MRI, we can actually, a regular MRI, we're looking at the anatomy of the brain, stroke, tumor, whatever. Functional MRI, we're looking at real-time brain metabolism. So if I put you in the machine and I say, think of an animal, an elephant, certain brain circuits light up. And then while you're in the machine, if I say, okay, now think about the last argument you had with your husband, boom, immediately the picture changes and we got the emotional centers lighting up. So this is not a good imaging tool to make a diagnosis, because what you're daydreaming about in the machine, the picture changes. It's a fantastic tool for
Wow.
the neuroscientists, though. They're like, oh, well, let me put a hot poker on your arm and see what happens in the brain. Well, look at that. Let me put that same hot poker on the other arm. Wow, that changed, but that stayed the same. It's given us a whole new language about what's going on in the brain. And so the new neuroscience is that, sure, the body sends signals to the brain, but it's the brain that decides, is that signal dangerous? And if your brain decides the signal's dangerous, then the brain warns you by creating pain. So pain is a protective mechanism. If I'm running and I break my ankle, I want pain. Yes, please. It's good for me. It keeps me off the ankle, lets it heal. So I now think of pain as nothing more than my brain's alarm mechanism to let me know I'm in danger or potential danger. And by the way, I now think all pain is in the brain. In fact, everything we experience is in the brain. But when I say all pain is in the brain, I mean all pain. I mean when my hand's on a hot stove. Message goes fingertips, spinal cord, danger alarm center, my subconscious brain always taking care of me. And it says, ooh, message like that from the fingertips, that's tissue damage coming my way. I better run an alarm. And my brain runs an alarm called finger pain, meaning it turns on some pain neurons. I take my hand off the stove. Now, that'll happen in a split second outside of my conscious awareness, but it was the brain that made the decision correctly that I'm in trouble, the brain that made the decision correctly to turn on the alarm to get me out of trouble. So I now think, oh, by the way, anxiety is the same thing. Anxiety is also a protective alarm from the brain to the body. And if I'm in a dark alley at night and I hear footsteps, I want anxiety. Yes, please. It's called the fight or flight response. And there's a lot of good things that happen to me when I do that. My muscles tense up, doesn't feel good, but I'll react more quickly. My heart pounds through my chest, doesn't feel good, but I need to pump oxygen for fight or flight. My stomach gets gurgly, doesn't feel good. That's my autonomic nervous system shunting blood away from my GI tract and towards my large muscle groups for fight or flight. So a lot of good things are happening there. It doesn't feel good, but I get a question from a lot of people. What do you mean these are protective alarms? How's that protective? This isn't protecting me. It's made my life miserable. But if you allow yourself to imagine yourself in that dark alley at night, your autonomic nervous system, in addition to all the other things I mentioned, is also going, we need more oxygen. I need to get us more oxygen for fight or flight. I'm the autonomic nervous system. I'm your lizard brain. I don't speak English. I can't tell you to breathe faster, but I do control the body. I know what I'm going to do. I'm going to make you feel short of breath. I'm going to put some squeeze on your chest here, some tension in there. At that moment, if I turn to my lizard brain, my autonomic nervous system, and I say, what the hell are you doing to me here? I feel like crap. My muscles are tense. My heart's pounding through my chest. I'm a little nauseated, and I'm short of breath. Could you stop this, please? If it could talk back to me, it would say, I don't give a shit how you feel. I'm not trying to make you feel good here, pal. I'm trying to save our lives. This is what I do. I'm making you feel bad to get us out of the situation. So I now see chronic pain, chronic anxiety as alarms from a brain. And the people when this lingers, I generally view it as a problem with a hypervigilant danger alarm mechanism. I see a hypervigilant danger alarm mechanism all day long in people with a history of childhood trauma. And you can imagine growing up in a rage a Holocaust or something. You grew up, you wired a brain together. It doesn't have to be that. I'm not even going to say it's usually that. I'll just say that's a common thing. But it can be all sorts of other reasons that your brain learned to do this. But we're now starting to understand chronic pain, chronic anxiety, chronic fatigue, chronic hard to explain medical symptoms are generally due to learned neural circuits that your brain learned for very good reasons. There's a reason your brain learned this. And when you do something over and over again, your brain learns it. That's true whether you hit a tennis ball or throw a baseball or learn to ski. You do it over and over, your brain wires neurons together. We call that muscle memory, but muscle memory is nothing more than neurons wired together. Your muscles only do what your nerves tell them to do. If you've been practicing pain, practicing fatigue, practicing anxiety for months, years, decades, your brain has a neural circuit there. The good news about this being a neural circuit problem is all neural circuits are rewirable. It's called neuroplasticity. And there are ways to access these neural circuits. I've just talked for a long time. I feel like I should shut up.
I don't think I've ever heard that explained so well. And I have had some people explain this phenomenally well on the channel. That was incredible. You broke that down in such an easy to understand way.
I have one more thing to say about that. That's a very important part of this whole understanding. And this is the understanding of where this is coming from in your brain. And I think it really helps people to understand that there is something running you that isn't you. This is your autonomic nervous system. There's a big part of your brain that is running your body, and it's 100% outside of your conscious awareness. This part of your brain runs your body through a network of neurons, the autonomic nervous system, and it controls everything: your heart, your lungs, your bowel, your bladder, your sweat glands, your immune system, your hormones. None of this stuff just happens. There is a conductor, and it's in your brain. You just don't have direct access to it. I don't have direct access to mine, and I don't want direct access to mine because I don't know how to run my pancreas. But this part of my brain is doing a lot of things all the time, making lots of decisions, but it only has one purpose. And in fact, I often refer to this because the autonomic nervous system evolved hundreds of millions of years ago. Every animal on the planet has an autonomic nervous system. It evolved in reptiles hundreds of millions of years ago. And for that reason, I often call it your lizard brain, because every animal has one. This is how our bodies stay alive without us always having to think about everything. But because it only has one purpose, and only one, which is keep the body safe. Keep this organism alive. Same purpose in me as in a lizard. So I often think of it not just as my lizard brain, but as my lizard on the rock brain. Am I okay? Do I need to duck under a rock? There's a part of your brain making that calculation every moment of your life. So this is the reason that we need a different set of tools to treat things like chronic anxiety, chronic pain, chronic fatigue, is because, yes, it's happening in your brain, but it's not happening in your thinking brain, or you would have thought your way out of it yesterday. That's not where it came from. We're not going to get at this with psychotherapy or going through all your crap and you need to reanalyze everything. This is not happening in the analytic brain. It's happening in a primitive part of your brain, but it is learned neural circuits that developed outside of your conscious awareness. And a very important message for everybody this is happening to, when I say it's learned neural circuits that happen outside of your conscious awareness, not your fault. That is a super important part of this message, especially to people who've been gaslit and sent all over the creation. And at least somebody, they didn't roll their eyes at you. They thought about it, and you could tell that. That's happened to so many of my patients. And it's just tragic that the doctor or the clinician seeing them just didn't understand what was happening. And if I can go on one more thing about the mind-body thing, it's because they still have this. Often the reason that doctor or clinician didn't understand it is because they're still operating in this world where the mind is separate from the body. Like, oh, we either have psychological problems or we have body problems. Are you freaking kidding me? Most of my brain is devoted to keeping my body alive. You know, resting metabolism, when you're just sitting there, whether sleeping, napping, doing nothing. And then if I sort of say, hey, Raelan, let's learn some difficult new math. Let's relearn a quadratic equation or how to solve this or whatever.
Please, let's not. Anything else.
But if you're in an fMRI machine where we're measuring brain metabolism and I ask you to do a complicated topic or read a complicated Shakespeare passage, whatever it is, and you have to actually focus, you know what? Your brain metabolism increases by about 3% compared to resting. Your brain is always taking care of you. It's very busy at this. And this is happening outside of your conscious awareness. You're not going to fix it with this thinking part of your brain. You need to get into access these different neural circuits. And those are what we access with mind body medicine.
So here's what I'm picturing. And I love this explanation. That we are not in charge of most of what's going on in our body. Something other than us is running the show. So I'm picturing, an office building, and we've got senior management, and they're all up on the top penthouse floor. There's the CEO and all the important people, and they're making sure the whole body stays alive and all the important things happen. And me, who I think of as Raelan, is like a low-level manager down on the third floor. I don't have access to that top floor. They don't consult me. They don't even care if I'm happy. They're keeping things running. So if that's the case, and I have no access to these people, and it's not happening on the third floor in my thinking brain, how do you change things? Like, how do we ever get past this?
Well, one thing you said there was they're just up there keeping things running. No, you're down here keeping things running. They're up there figuring out how to make more money and making it, but the running of the daily activities, that's not happening up there. That's happening down there. You're already doing that on that lower floor. Again, it's just part of you you can't control. You, Raelan, is up here. So what we want to do is traditionally what's happened here is that sometimes I use an analogy of your crew brain and your captain of the ship brain. There is so we want to start. This generally starts with some education of the captain of the ship, because yes, they are the boss and they are running things, and they may not know exactly the job you're doing. Like, I don't know exactly how my autonomic nervous system runs my heart rate or my digestion, but it seems to do it. But I can at least yell at it when it's having a problem, or I can put a drug on it if it doesn't seem to be doing it right or something. I at least feel like I've got control over some of this. But anyway, the first part of this, though, is some education of the captain of the ship, the cognitive brain. So most of what I do starts with the new neuroscience education and helping people understand, do you see what's going on here? There's another explanation besides it's all in your head. Everything's in your head. How do you think your body runs? Your brain controls your whole body. Everything's controlled by that. It's just not having this thinking part. So that's an important first step, is the education, for people to read, for people to watch videos, for people to listen to podcasts and go, oh, wait a minute, that's a different way of approach. Let me watch a few more of those. That's something that's now we're educating the cognitive brain, the captain of the ship. So I like to say, if the captain of the ship doesn't get these ideas, your crew will never get them. So the education, step one. Step two, but that's just step one. Okay, I kind of get the concept. I see what people are saying. Now we have to educate this part of your brain. And this part of your brain doesn't learn by reading books and watching lectures. This lower part of your brain, this more primitive part, learns by experience and repetition, which is how my autonomic nervous system got the way mine is, and how yours got the way yours is. A lifetime of experiences. If we want to start changing it, we start giving it new experiences. Specifically, we start giving experiences of safety. More specifically, we start giving it experiences of safety in the body, that the body is actually okay. And you can't do that if the captain of the ship doesn't think the body's okay. And that's why the education up front is so important, that we now know that chronic fatigue, chronic pain are due to learned neural circuits, not because there's some mystery virus that no one has discovered or some allergy or chemical sensitivity that you happen to have. The vast majority of these things is a reaction by your brain. There may be some stuff coming in when you are exposed to a certain chemical or when you eat a certain food. That certainly different input comes in. Your brain is overinterpreting that. But once you understand what the brain is doing, now you can start teaching this other part. But you do have to at least have an open mind to the idea in your cognitive brain that, this makes more sense. And I love having that discussion with people. Well, what do you think's wrong? And having that back and forth. Yeah, that doesn't make as much sense to me. But in mind-body medicine, I sort of operate with a couple of fundamental principles. One is that you have your own innate wisdom about what's right for you. And if you can listen to it, you're going to know. So when I tell you, no, I think it's this, let's have a discussion there. I'm not God. Maybe I'm wrong about this. What do you think? And so that back and forth is often super helpful to people, to help them to come around to my point of view, or to say, you know what, I don't think this is going to work for me. Great. It's not going to work for you. I'm just telling you what I've seen.
So what does this all mean for people who are listening and watching? Because so many people who watch this channel are getting really up to speed on mind-body medicine, but still are understandably unsure what this means for them when they're facing ME/CFS and long COVID. What do they do? How do they start to turn these symptoms off?
So I said the first step is education, but that takes a little while, and you kind of read this. And I often tell people I'll do some education maybe on a visit one in my office, to the extent that I can. And I'll tell people at the end. I say, look, I just explained this kind of some of what I just explained here already, and they're like, "Whoa, well, that's okay," and they're starting to believe. And I tell them, I can send you out of here with a good attitude, like, "Oh, hey, wait a minute, this sounds different. Maybe I got this." Tomorrow morning, when you wake up and you can't even drag your ass out of bed, this is all going to go out the window. So it sounds good now, but this is the part of your brain we're trying to retrain here doesn't learn by listening to a message. That may start retraining this part of your brain, but this part, it's experience and repetition. So we do have to start giving it new experiences, and that can be difficult when you're stuck in bed with fatigue, you can barely get off the couch, or you have some other pain or some other problem. It can be really difficult to even do the exercises. Or to even, okay, I wrapped my head around it yesterday, but today I have so much brain fog, I can't even wrap my head around this. Wait, what am I doing here? So I love people to start with super short, super easy things. And this is before you even understand anything. You don't have to understand any of the neuroscience to start with active mini meditations. They're quick, they're less than 5 seconds long. You can do them throughout the day, and you can even set a timer on your phone. And when it goes off, when I do this, and I recommend to people to do this at the beginning to get used to doing it. My phone goes off. I look at it and it says stop or repeat. And I hit repeat, knowing it's going to go off again in 90 minutes. And I say, I have 5 seconds. And I do a 5 second active mini meditation. The first active mini meditation is called Drop Your Shoulders. And that one looks like this. Hardly anything happened. If you're kind of wondering about it, you could raise them to your ears and let them go. The second active mini meditation is one slow, deep breath in and out through the nose. And that looks like this. Here's what's happening. If I'm about to be attacked, I'm like this. And I would never do this. When I do this, I just sent a message of safety to my brain. And I sent the message in body language. This is the language of the autonomic nervous system. All day long, this part of my brain is sending and receiving messages to and from the body. This is a message of safety because nobody sits like this under threat. When I do this, my crew brain down here is going, hey guys, the captain of the ship just stepped in, has us doing slow nasal breathing. Everything must be okay. Because nobody slow nasal breathes under threat. We rapid mouth breathe under threat. These are two body-based messages of safety to the brain. Every time you do that slow, deep breath, you activated your vagus nerve, which of course carries 75-80% of the parasympathetic fibers in your autonomic nervous system. Your autonomic nervous system has two parts, sympathetic, parasympathetic, fight or flight, relax. And this is not a theoretical construct. These are real nerves going to real organs. You can dissect them out of a cadaver. And we all live in a balance of sympathetic tone and parasympathetic tone. Sympathetic, fight or flight. If I need to climb a flight of stairs, I ramp up sympathetic. If I need to give public speaking, I ramp up sympathetic. Time to chill with my buddies, ramp up parasympathetic and have a beer or whatever. We're all living in a balance, changes moment to moment. And most people in modern society tilted a little towards sympathetic. Chronic pain, chronic fatigue, anxiety can be way out of whack. Stress in your other like crap happening to you can be way out of whack. If you want a stronger parasympathetic nervous system, then we exercise it. These are two exercises of your parasympathetic nervous system. And neurons that fire together wire together. Nice rhyming phrase, comes from the neuroscientists. They see it happen. So if I fire my vagus nerve, my parasympathetic, and I fire a few more parasympathetic neurons, and I just do this here and there throughout the day, at the end of the day, my brain's like, wow, we seem to be firing parasympathetic neurons here and there. All right, if you're going to do that all the time, let me start wiring some of those together for you. You are literally building a stronger parasympathetic nervous system, whether you want to or not. It's not a choice. This is just a function of how we are put together. So you don't have to meditate for half an hour. You don't have to think happy thoughts, and you don't have to go to nirvana. Just do the damn exercises. What happens over a couple of weeks? You might be surprised. So that's a simple little intervention for anybody can do it. And you don't have to have the understanding yet. I have had so many people tell me, well, I was waiting to see you, but I watched some video and you showed me these active meetings. So I started doing those. just in the 2, 3 weeks I was waiting for this class to start or waiting for our appointment, I already noticed some things changing. I hear that all the time. It's not the cure, but it's a
Yeah.
beginning entry point in. I have another beginning entry point that I often show people in visit one or something. But anyway, the first easy one. Happy to talk about more.
Oh, we will take all that we can get.
I mean, if you
If
want
you
the second simple, easy thing that people can do, again, on this alarm, I'm a big fan at the beginning of this alarm idea because you forget to do this. It sounds good, but stuff's happening, chaos, stress, or just fatigue. You can't remember. So that alarm is critical. I find that almost everybody tells me by day 2, I don't need the alarm anymore. I got used to checking in with my body. And the third thing, so we've got the 2 active mini meditations, but the third thing I like people to do that you can do quick, easy, that you don't need a lot of training for, you don't even have to educate yourself first, is checking in with your body. When you check in with your body, you are checking in with your autonomic nervous system, the part of the brain that is running the show here and is making you feel like crap. Check in with it. And you can check it, and we're checking in with it not to yell at it. Remember, your brain's not your enemy. Your brain's trying to protect you here. It's just gotten overprotective. So we just want to teach it, hey, thanks for taking care of me. I might have needed that when I actually had the infection or had some reaction to something, or in my distant past that you got used to doing that and you just brought it up again when when my immune system got activated from that vaccine. Very real stuff happens in the body when you get a vaccination and your immune system gets activated. What I think happens, and I think this only because I just see people get better from this all the time. Yeah, they had a real reaction to it. Their brain said, hey, the immune system, some stuff just happened. Uh-oh, holy crap. And when the brain said, holy crap, what did it do? What does the brain do saying, holy crap? Just sends more problems to the body. We better lay low. This is problematic for us. And if it does it very long, it gets into a habit. I like to call this a habit loop that the brain is in. So we just want to train the brain out. And by the way, before I talk about that third thing, I just want to emphasize how common habit loops are. I see people who are like, what do you mean my brain? How could that happen? There's a story that Gabor Mate tells. And I remember hearing him say this, that he talks about how when I was 2 months old, the Nazis invaded Hungary and my dad got sent to a labor camp. And there I was with my mom in Budapest. And a few days later, she has to call the doctor. She says, Doctor, Gabby hasn't eaten for 3 days. He won't nurse. He won't touch a bite of food. He's crying all the time. Something's going on. And the doctor says, well, Mrs. Mate, of course, I'll come see him. But I have to tell you, all my Jewish babies are crying. And what do I know about Nazis? I'm 2 months old. What was I getting from my mom? What were we all getting? And if I extend his story, he doesn't talk about it this way, but do you know how many neurons per day your brain is wiring together when you're a little kid? We do know now. Your brain is wiring together approximately 1 million new neuronal connections per minute.
Goodness.
0 and 7. 100 million new synapses in your brain between the ages of 0 and 7. It slows down a little bit after that, slows down a little. By your early 20s, you sort of stop automatic. By your 30s, you're having more loss than gain. But anyway, so, oh, wow, no wonder I had an addiction problem. No wonder I had to get on antidepressants in my 30s with the stress of life and a family. So I had wired together a hypervigilant brain. I don't even remember it. My autonomic nervous system remembers it. So that story and the other stuff I've read about in neuroscience has completely changed my view of stress. People would come into me as a primary care doctor for years. These stories, I've been all over and I can't figure it out. Often at that point, I'd say, you think stress could be a factor? If I know the person, I have a relationship, they're willing to talk about this. People know that stress impacts them. But I'd often get a response like, well, I thought about that, but I'm getting to bed on time. I'm eating healthy. I'm going for a walk every day. Now, 20 years ago, when my son was hooked on heroin or I was going through a divorce, that was stressful. But now my relationships are actually pretty stable and my finances are okay. And like I say, I'm taking care of myself. My old response was, okay, I was just checking, making sure. Sounds like stress is how you're doing okay. That's not how stress happens. Stress could be something that happened 80 years ago and your brain got in a habit. Stress could be 15 years ago. You had cancer. I hope you got hypervigilant. I hope you were aware enough and alert enough that when you felt a little bit bad that time you were sitting in the ICU that you pushed a button so they actually could come and do the code blue that just saved your life 15 years ago. Your brain's not hypervigilant after that. There's something wrong with it. Of course it is. And so anyway, the different view of stress. So I like people to understand that this isn't some woo-woo like, oh, come on, just get over your past experiences. This guy was 2 months old And his autonomic nervous system was learning a way of being from his mom. Then probably good to have a hypervigilant autonomic nervous system. Growing up in Nazi-controlled Hungary as a Jew, I hope I was hypervigilant. You grew up that way, then that's how your brain is. And we used to think that was immutable. Like, yeah, that's how your brain is.
I love that explanation because so many of us, and I hear from so many people that I interview that, well, we have some things from our past or from our childhood, but we feel like we should be over it, or it's a weakness as a human being if we still need to talk about our childhood. But it's not about that. It's not about how strong you are or should or shouldn't. It just comes down to the wiring in your brain. And this is what needs to be addressed.
Raelan, this is not about coping. Most of the people I see with chronic fatigue, long COVID, chronic pain, even chronic anxiety, most of those people that I see have coping skills out the wazoo. The majority of them drag their ass out of bed every day and walk their dog, or make breakfast for their kids, or take care of their mom, or go to a job. Maybe they've had to cut back. Certainly, some people completely overtaken them. I understand that. But the majority of people I see, and even those people it's overtaken, still have coping skills. They're still getting up and trying to figure stuff out often. So, anyway, coping skills, I tell most of my patients, you could come teach coping skills to some of my patients. This has nothing to do with coping skills. I'm talking about some neural circuits way beneath that. We're not going to teach you coping skills. We're going to teach you how to rewire these circuits so you don't have to cope with them anymore. But you do have to get over that hump of you're not strong enough. This has nothing to do with willpower. A lot of my patients with in fact, a big barrier to success is some of my best coping patients. They're so good at coping and dealing with adversity. Yeah, I've dealt with adversity before and I know how to do it. And they're so good at that, they want to use that attribute for this problem. It's not going to work. You cannot overpower your autonomic nervous system. There are orders of magnitude more neural synapses in your non-thinking brain than in your thinking brain. Orders of magnitude more. You will not overpower it, but you can teach it. And when you teach it, you can teach it to calm down. You can't teach it like this, though. It learns by experience and repetition.
So did we get to the third thing that you were going to tell us?
Well, so people, you ask, what can you do just starting this? Where do I even start here? I need a little foothold. So I got my 2 active mini meditations. The third foothold for people when you're just starting is a quick body check-in. Again, when we're checking in with the body, we're checking in with the autonomic nervous system. And we're checking in with it, not to yell at it or do anything. We're just checking in. And saying, what's going on there? We're starting to teach this lower part of the brain that there is a way to have body sensations with something other than, oh my God, what's going on? Uh-oh, what can I do? Should I go reach for my pill now? Should I take my nap now? What should I do? Should I walk around the block? Sometimes that helps, whatever your thing. But instead of that, this is different. This is just a checking in, and we're not doing a damn thing about it. We're just going to check in and observe. It's just an awareness exercise. And this is something that takes longer than 5 seconds, but it doesn't take longer than a minute. So again, when that alarm goes off, you could say, oh, I got 45 seconds. Yeah, let me do that. Or I only have 5 seconds right now, or I only have the energy for 5. Then do the active mini. But if you got 45 seconds, here, we can all practice a quick body check-in right now. You might just find an area of tension, tightness, constriction, discomfort in your body. And I'm not looking for anything severe. This could be a level 1. Well, there's always something going on in my body. Just find that. Where can you find any of that? And then that area you found, draw a line right up and down the center of that sensation. That's easy. If it's in your chest, you're going to draw the line right up and down. But even if it's off center, can you imagine that area? There's that thing. Draw a line right up and down the middle of that area and ask yourself, is the sensation more intense on the left side of that line or the right side of that line? Can I tell any difference? And if your initial response is 50-50, look very closely. 50-50 is an acceptable answer. But are you sure about that? Do you notice a 60-40 difference? That's the whole exercise. We're done with that. That's it. The answer doesn't matter. I mean, it might matter to you because actually, let me ask you, were you able to find a spot? And
it was, yeah. I could feel some tension in my upper back, and I wouldn't have said it was on one or the other. But when I thought about it, I'm like, oh, it's definitely the left. It's more significant on the left.
All right. Right now, your brain is processing. That was an experience. It's an experiential learner. And your brain is now processing that experience. It's going, that was different. Usually when we notice tension in the back, we take a few deep breaths or we ignore it. because it wasn't that bad, and I'm in the middle of an interview, so why should I pay any attention to it? Of course I'm going to. Or if you're not in the middle of something, you might distract yourself. I'm going to go watch YouTube videos. So I just can't do. You do something. All right, I'm going to try to fix it. This is different. We looked at it. We asked a quick question, and then we went on with our day. I didn't know we could watch discomfort that way. And we're starting with mild discomfort, like a little tension in your back that you can ignore. People are like, well, why would I want to pay attention to that? I can ignore that. My back's not my problem. My problem's my brain fog or my headache or my heart palpitate, whatever. Start with whatever's that you're, when you do that, and especially if you do it when an alarm goes off, now you're doing it on your schedule, not on lizard brain's schedule. You're telling it, I'm not afraid to go see what you're doing right now. You're sort of giving it the message because you've been kind of afraid of it. It's been hijacking you, and you kind of want to stay away from it. And you're just by even doing the exercise, just going there. The alarm goes off, I'm going to look for a body sensation. Just that act, your brain is kind of, you're going to look at me? I thought you were afraid of me. You're, no, I'm not afraid to look at you. And so it's processing that. You do that over and over, and your brain starts learning that you're just starting to give the preliminary messages that the body is a safe place. You can do these little mini meditations quickly, or you can even turn towards a sensation and ask a question. You can do a little bit. I love the 60-second version of a body scan because that's another thing that I sort of give people a couple of different options. How do you do a quick body check? And one of them is just the left-right question, and you're done. You can do another one, and I don't know if there's I got others, but I can't go through every exercise I had, but I can go through one more quick one just for that foothold if you want to. But there's
let's do one last one.
You can do one more, and you can edit out what isn't working or what's.
Oh, we're keeping it all. There's no way.
So here's another kind of quick body check-in, a little bit different, a little bit longer, but anyway. So join me with this one, and I suggest you close your eyes. And again, your alarm just went off. Time to check in with the body. Alarm just went off, and just noticing now, what can I feel in my temples, if anything? Just noticing. And again, nothing or numbness is acceptable. Just noticing. Is there anything there? What sensations can I feel in my jaw? Left. Right. What can I notice in the back of my throat as I breathe gently in and out, if anything? My neck and shoulders. What is here to feel? My chest. Any sensations as I'm breathing in and out? My abdomen. The pelvic floor. Done with the exercise. That was not a relaxation exercise. I never said relax. We didn't do anything. We're not trying to control the autonomic nervous system. We're just noticing. And again, the brain is now going, I didn't know we could watch. I didn't know there's anything there because you're pretty good at ignoring all the signals I usually send you. They're mild because you've got good coping skills or you've figured out how to get through them. So good for you, I guess. But I'm still got a little bit of alert here. And usually when you do notice them, you immediately turn away from them. This was different. You looked at them, acknowledged them. Oh, it feels kind of like this. Oh, now you're going to move to the next one. Oh, you're going to move to that. Your brain is going, I guess the captain of the ship isn't very scared of anything going on here. That's weird. Huh. I thought he was worried about everything. He seems in the past, whenever he noticed anything, he kind of freaked out or he ran away from it. This time he just sat there, watched it, then moved to the next one. Didn't know that was possible. Your lower brain is learning from your cognitive brain just during that exercise that it must be pretty safe, or the captain of the ship would have been doing something different than just sitting with it.
Yeah, and it feels like really good practice as well at listening to your body, because as we did that scan, there were so many sensations that I didn't even realize were there. So just checking in with what's going on. And then it was amazing how, without even trying to change anything, by the end of it, it had lessened slightly whatever uncomfortable sensations I had. And I felt completely relaxed despite never once trying to relax.
I love that. Yeah, I said it's not a relaxation exercise, but it certainly can be. Isn't that weird? I felt relaxed without trying. This is what we resist persists. And this is all the whole lesson of mindfulness and whatever. You don't go get mindfulness. It comes to you. I often tell people, we're going to try to get out of fixing brain and into allowing brain. We're getting out of thinking brain and into feeling brain.
So, what about all the things that led up to the person being in their nervous system, this high alert state to begin with? Is getting back to a place of not having these chronic symptoms mainly about doing these types of retraining and experiential activities? Or do people need to, go deeper and, resolve things from their emotions or their past or their environment or their relationships? Is there a bigger piece?
Yeah.
Murder piece.
I think that part can be harder, but I also think that there's no one right answer. And I think, again, we all have our own. I got two fun. I said I have some operating principles or some fundamental beliefs. The first one is that the human body is an amazing healing machine. And in fact, it's our natural state is to be healthy. Well, you wouldn't think so, listening to the medical establishment or the society that's out there. It's like, have you had your colonoscopy? Have you had your mammogram? Have you had this vaccine and that? I'm not arguing with getting those things, but I am saying that there's an entire medico-industrial complex around turning you into a patient. And I've watched this over the 30 years of my medical career, where diabetes used to be the definition was a hemoglobin A1C of 7.5. And then this is when I was in medical school. And then sometime early in my career, no, we're going to call if your A1C is 7. Oh, no, we're going to call 6.5. Now, if it's above 6, we tell you, and if it's between 5.6 and 6, we tell you have prediabetes. So, I mean, we've created diseases by lowering the threshold. Now, this is with good intentions. Oh, we're going to find it early and do something. But the truth is that we've created a society where we all think we always have one foot in the grave, and we don't. So anyway, one principle is the human body is an amazing healing machine. I've seen people crawl off deathbeds, literally. And two, you have your own innate wisdom. So which part of this do you need to access? There's the neural circuit going on, that autopilot circuit that your brain has developed. What can we do to retrain that? That's the part of that puts increased stress on the that's keeping your autonomic nervous system hypervigilant. Everything that comes in, the brain reacts like this. And how can we teach it a different circuit? So that's teaching it a different circuit. I call that Alan Gordon and pain reprocessing therapy, somatic tracking, that kind of thing. Graded exposure, there's some different tools that you can use to help teach your brain that you can have sensations without alarm. And you practice that enough, and you get out of the pain-fear cycle or the fatigue-fear cycle and into the fatigue-allow cycle. Fatigue-allow. You practice that enough, pretty soon that becomes your new circuit, and even your autopilot brain starts when you start feeling tired. Starts going, oh, I can probably do this anyway. You're not going, I can do this anyway. You're going, oh, I've had so much experience of being shown that it's not an alarm. I think I'll go ahead and finish this activity today, even if it makes me feel worse later, because I know I'm not doing anything dangerous. So you can retrain the brain. That's the Alan Gordon. That's the getting out of that cycle. Then there is this other side that you're talking about. And I call this the under the hood stuff. And this I call Nicole Sachs and Howard Schubner. And now, all these people know all of this, by the way. It's not like Alan's stuck over here and Howard is stuck over here. They all practice all of this. But Howard and Nicole, I think, are particularly eloquent about talking about this under the hood stuff. And so this would be your emotions, your negative self-talk, how are you talking to yourself? These under the hood things, and those can be autopilot circuits too, by the way. And so many people, I think, with chronic fatigue need to turn towards that. And because that's another thing that keeps the brain hypervigilant. So an important part of mind-body medicine is getting out what's in, whether that's thoughts, emotions. So an example of an emotion, a classic one, would be anger. I see a lot of people who say, I'm angry, and I'm not repressing it either. This isn't a repressed emotion. I mean, I know I'm angry. I'm pissed off at this guy or this situation. But, what am I going to do? Write a nasty email? Punch somebody in the mouth? I'm not going to do. If I wrote that email, what would happen to my family dynamics or my job situation? No, wouldn't be helpful. I'll keep it under the hood. You may be able to keep it under the hood. Your autonomic nervous system knows you're angry. And when I'm angry, I'm hypervigilant. If I do have an alarm running, I won't be turning it off. So this idea of getting out what's in is very important to a lot of people. I think there are other ways than writing or EAET, this new emotional awareness and expression therapy, of getting out what's in. I think those are proven ways. I'm not maligning them at all. I use them both. I like those. I think there are other ways, almost from a body-based approach, to get emotions out also. But I think everybody has to figure out, okay, where do I need to go here? And that's also where it can help to be working with somebody, a coach or a trainer or a doctor, whoever, somebody who knows what they're talking about here. But people can often figure this out for themselves. And I'll often ask people, where do you think? You think the problem's more in that circuit and we need to work on watching things without trying to fix them? And people will recognize this, say, yeah, I can't watch anything in my body without trying to fix it. Or do you think it's more you've got some crap underneath that you need? And often people will tell me, I want to do some working over here. Oh, well, let's get at that then. So I do think they're both important, and I don't think there's a single right answer. I will say, just anecdotally, in my experience, a lot of things like chronic musculoskeletal pain do very well, or pretty darn well, with just staying over in the let's retrain the brain. My general experience is that chronic fatigue, there's some stuff under there. No, we all have stuff under there. It's not like, oh, you have chronic fatigue, you have stuff under your hood. Duh, who doesn't have stuff under your hood? You don't have stuff under your hood. What are you, a dog? I mean, no.
Oh, even my dog has stuff under his hood.
So we all have stuff, and I think we could all benefit from doing those things. And I think this goes beyond, what this really, what that question really makes me think about is this goes beyond getting rid of your pain, getting rid of your fatigue, getting rid of your brain fog. This is about changing who you are. This is about changing the way you go through the world. So, and in fact, if your only goal is to get rid of your pain, you're probably not going to, or your fatigue, this is not going to succeed. So one of my favorite questions for people is, how do you find joy? And a lot of people who've been in pain or fatigue or had their life torn apart by whatever's been bothering them have a lot of difficulty. They're like, joy? When was the last time I felt joy? And they can't even think of that. But it's a very important question. You don't learn French by telling yourself, I'm going to stop speaking English. My goal for today is to get rid of English. You're not going to learn French. And you're not going to get rid of pain by telling yourself, my goal today is to get rid of the pain. We need to be moving towards something. So part of any treatment or therapy is sometimes some exercises, whether those are writing exercises, thought experiments, meditations. Ask yourself, how do I find joy? And can you start firing those neurons? This is all about just neurons and neural networks. And can you start? Then there are some very specific exercises of let me fire. And when you first do them, you might kind of feel like, well, I didn't really feel anything. Guess what? Neurons that fire together wire together. Did you fire one or two neurons and you barely didn't feel much? Try it again tomorrow. And so there are things you can do to move yourself towards not just turning off the unpleasant neurons, but what are you working towards in life is a very important question.
I love that so much. I want to get this embroidered on a pillow. I have so many things that I envision are on this couch back here, but you're not going to start speaking French by stopping speaking English. It's just.
I don't even know if he remembers this. I stole that from David Hanscom.
Okay.
And it was some little thing he said sometime, somewhere that I think it was offhand comment. I don't know that he's ever repeated it, but I'm like, oh.
Yeah. Yeah, I love it. And I heard another doctor say there's no such thing as original content. And he probably got that from someone else. I think we're all taking and borrowing, and it's just, adopting what really resonates for us. So here's where I wonder how we all move forward from here, because I'm uniquely positioned to get to talk to so many people like you who get it. And you're working with patients and you're doing great work. And I feel like this is information is common knowledge now, which I know it's not, but because I talk about it and hear about it so much. So how do we bridge that gap? It seems like we have a divide. Like people are either going through the conventional medical system and maybe not getting very far, or maybe being fortunate and ending up in an office of someone like yourself, or they completely wash their hands of the medical system and they're like, okay, I'm just going to go with coaches and recovery programs. And what I think needs to happen is that there needs to be more of a partnership and working together, because there are a lot of great recovery programs and coaches out there who are doing, I would say, a large majority of the recovery work in these spaces. But it's a little bit of the Wild West as well, because nothing's regulating it. So, so I'd love to hear your thoughts. Like, can these two groups work together? Should they? How do we reach the most people and get this information out to the most people?
Yeah. When I first started this, again, I thought I was, at somebody who, duh. Oh, well, I just have to tell everybody and then they'll get it. I mean, my colleagues.
Yeah.
And I started explaining to some doctors and stuff. And okay, so we do some education. You help these people see that this is happening. They've got to sort of rechange how they're thinking about it. Rechange how they're thinking. That sounds like the placebo effect. And I'm like, okay, let's call it that. Whatever. I don't care what we call it.
Yeah.
Your brain's very powerful, but immediately it goes over here. And so, yeah, doctors and the medical system has weirdly sort of lost its respect for the placebo effect. And despite the vast number of studies, in placebo, in placebo studies, surgery always works better than a pill. The red pill always works better than the blue pill. The large pill always works better than the small pill. Over and over again, these things happen. It's a very real thing. I think what people don't realize is just how powerful your brain is. And there's a lot of
Yeah.
data on this. And anyone who's wondering how strong your brain is, there's a great book called The Expectation Effect. And I'm blanking on the author, although I'm sure we could look him up in 2 seconds. But The Expectation Effect, it's really well grounded in science and a fantastic book about not about pain or fatigue. It's just about how brains work. And it's easy to read. It's fun little anecdotes and stuff. But you come away from that going, holy crap, my brain really does control my world. So anyway, I'm getting off point to your question. How do we bridge this gap? When I first learned this, I thought, oh, this will be quick and easy. I'm just going to tell people about it. And here I am 6 years later, and most of the docs in my community are like, oh, when did you go see Brad? But then the person comes to me, and with a few exceptions, and it's usually the primary care docs and the neurologists, by the way, who get this because they see all sorts of stuff that nobody else can figure out. So they're quicker in general to send patients to me. But even some of the ones who I know get it. By the time the patients to me, I'm like, you've been doing all of this for the last 2 years. You've had all those wait, and then when that didn't work, you went to a different specialist or a different guy in the same specialty to get more shots. And I just keep, how come they didn't? I know this doc has referred patients to me before. Why didn't it happen sooner? So I think there is a big paradigm shift, and I don't know now. I have to say I'm a little frustrated and cynical whether it's going to happen because Western medicine operates in the biomedical paradigm. And there's nothing wrong with the biomedical paradigm. In fact, I practiced in it for 30 years, and it's very powerful. The biomedical paradigm is reductionist. We take a complex system, the human body, we break it down into its constituent parts, and we go, there's the problem. I found it. That is fantastic if you have type 1 diabetes. I'm glad somebody figured out the pancreas and insulin and how to get that out of a dog's pancreas, which was the Nobel Prize winning thing back in the 1920s, and administer it to a child. Type 1 diabetes was 100% fatal, 100% before the discovery of insulin. That's Western medicine doing its thing, figuring stuff out. It's the reason we have stents in coronary arteries and ventilators in ICUs and dialysis machines when your kidneys fail, because kidney failure was a death sentence. Absolute. Now we got dialysis. I'm not saying maybe there's something better in the future, but geez, these people live lives. But it's so powerful that Western medicine wants to use it for every problem. And it doesn't work for about a third of what walks into a primary care office, where it's more complicated than, oh, if we just block the right receptor, we'll figure this out. We don't need the biomedical model for these problems. We need the biopsychosocial model where, yes, we're going to take the biology into account. Everything's biologic. Duh, chemicals are changing. Yes, that's very true. But why are they changing? What's your social situation? Are you living in an abusive situation where your autonomic nervous system has to be on hyper alert, and therefore your immune system stays activated, and all these things are happening, and certain alarm bells aren't going to turn off? What's your psychology? How did your brain develop? Did it develop in a certain way? Oh, yeah, no wonder you're like this. But that's because that's how brains develop, not because it's your fault. So I like to make sure, going back to that idea about helping people understand that this isn't their fault, that I like to tell people, let me just change the narrative here. And I think this is an important part of mind-body medicine in general, is we don't view chronic medical problems, most of them, once you've done the due diligence, chronic fatigue, chronic mood disorders, those aren't diseases. We don't need to pathologize or medicalize them. That's the biomedical model it's called. These are normal things that happen to all of us. We all have pain, we all get fatigued, and we all have anxiety. They're normal. Now, if they're running all the time, they're not good, but at their root, they are protective. It's protective for me to get super tired after I do too much activity. That is a protective alarm, just like anxiety, just like pain is a protective alarm. So that doesn't mean, again, that it's good that it's happening. I'm not trying to minimize how bad these things can be, but I just want to say their root reason for being, their raison d'etre, is a protective alarm, not disease. Everybody on the planet has had these things. Not everybody's had appendicitis. That's a medical condition. Not everybody's had a heart attack. I want the stent in my coronary artery then. These, though, are biopsychosocial problems. Everybody has had them, and it's a learned behavior. So I often tell my patients, let me show you how not abnormal your brain is, or how not diseased. I've just spoken with you, John, for 20 minutes. I just met you. I've heard this much of your life story. But just what I've heard, if I were to ask you right now, you ever feel a little on edge, little hypervigilant, a little bit like the other shoe's about to drop? If your response to me, John, was, nope, that doesn't make sense to me. You haven't pegged me at all. That's not me. That would be a brain disorder. Based on what I just heard about your father or your cancer or your brother or whatever, did your brain not get hypervigilant doing that stuff? What's wrong with it? What you have now is a normal brain that was reacting to some stuff. Anytime it reacts in a really threatening situation or over a period of time, it develops a circuit. That's all you've got. It's a normal brain. But that doesn't mean it's good or that you still need it. Let's try to change it, but let's operate from the viewpoint that you're okay. And that is just flipping Western medicine on its head. That you go to a doctor and they fix you. And it's a little threatening. I'm not saying it's consciously threatening. Doctors don't go through this in their head, but we're there to help people. And this person comes in and now I've got to give them a message that they can help themselves. How can I do that without suggesting that it's all in their head? And they don't know the narrative or way to explain it to people. So, I'm in Boulder. We're 30 miles from national Jewish hospitals, like always number 1 or 2 on the best respiratory hospitals in the world. They had a long COVID clinic. I had many patients go to their long COVID clinic. They did a bunch of tests. They approached it from the biomedical model. I don't understand. But one of the things that made me realize how difficult this divide was going to get over, I gave a little TEDx talk, and TEDx would not publish it, except, what do they call it? There's a word they use where they publish, it doesn't go into any algorithm. You can't search my name. You can't find it. You have to have the.
Oh, wow.
So, and the reason they gave, I'm going to read it. They said, this is a sensitive topic for many audiences, and insinuating they can be treated or reversed through lifestyle or mindset can be stigmatizing and dangerous for some viewers. So,
My goodness.
unlisted. So, this is a big hump to get over. It's just a different framework, a different way of thinking. And I love and applaud, and I'm so grateful for all the people who are moving the pendulum in this direction, but it's moving a lot slower than I wish it would. So I'm going to keep pushing in that direction. And I don't know if it's ever going to break into the mainstream as every long COVID clinic will, of course, be doing this. I hope so.
Yeah. What worries me is I'm seeing more of a divide, either conventional medical system or you go through coaches and courses and recovery programs. And then many people like myself, because I felt through my 10-year journey with CFS that I got virtually zero help. I did have one really amazing doctor who tried, but didn't have the answers, that I just washed my hands of the medical system for a long time. I'm like, they know nothing. Like I was so jaded, and I wouldn't go in for everyday things. And it took me a while to get that trust back. I'm like, wait, no, I do need doctors. They do know stuff. They can help me. I'm living with things that are very fixable and they are very knowledgeable about. So I guess from our end, from the people going through these, this is my hope and my dream, because a lot of people are getting better through these coaches and recovery programs. And I have a brain training course as well. And it's not, medical treatment. I'm just providing information. I'm sharing the science. I'm, sharing nervous system regulation tools and brain retraining tools. But what I want is for people to take this to their doctor and be like, this is what I'm learning.
Mm-hmm.
This is what I'm doing. Is this safe for me? Have we checked everything in my body? Does this make sense? So that they're still working with their doctor. They're still getting that professional medical care. And then also it starts to infiltrate maybe the medical system a little bit as well. And maybe some of these doctors that have not been exposed to this will start considering telling their future patients, well, I have been hearing about some different ways to go about this.
Mm-hmm.
So I don't know.
I think that's happening. I do think it's happening. It's just
happening
a lot slower than I would.
Very slowly. Yeah.
And it's weird, the medical mindset or the doctor mindset. And I don't know, maybe this will change as the next generation comes along, but we're sort of trained to make sure to always find the answer and do the next test and be a little sleuth who figures this out. So this can be very challenging to give people a message of safety when we have so many tools that will always find something wrong. I mean, there's all sorts of data, and you're probably very familiar with this on the, normal. If you just take 100, if you take 1,000 normal people who have no back pain, if you're over age 50, we will find an abnormality. Period. You are going to have something, some disc problem or arthritis problem. If you came in with back pain and we found it, then we're going to tell you that. In fact, there was a recent study. Actually, this is just a few years old, where a group of people who had back pain longer than 12 months or not longer than 12 weeks. And that's about at the point where you go, well, I didn't think it was anything because your exam is okay and you don't have a fever or anything really worrisome, but 12 weeks and it hasn't come. Okay, let's do an MRI. Anyway, they split all these people got an MRI and then they split them into two groups. This group got told exactly what was on the MRI. The average age in this cohort of people, by the way, was 40 years old. 40, not very old. And they told them everything. You have a little arthritis here, a disc bulge there, blah, blah, blah. The other group had the same findings. I mean, they all had MRI findings. The other group got told, we see normal age-related changes, nothing dangerous going on here. 6 weeks later, the pains, at the time of the MRI, the average pain score was 6, patient estimate. They said, yeah, my pains was 6. 6 weeks later, the group that got told all the little problems, pain scores were 7. 6 weeks later, the group that got told normal age-related changes, pain scores were 2. So the way we deliver the information makes a big difference. But that's kind of a hard sell for a doctor who you came in for him to find something, and then he's going to go looking. And if we do enough tests, our testing has gotten so detailed now that with MRI, we see every little square millimeter of your body that doesn't look like it did when it was 10 years old. And then the radiologist calls that. So it's really tough for doctors. I noticed the first couple of years, even after I'd switched and I was in a mind-body clinic, I found myself that the patient was so like, oh, there's so many, maybe I'm missing something. That's an important question for me to ask, actually. And I would often tell them, okay, wait a minute. You've just gotten me because of all your worry let's go over your medical stuff again. Okay. So, but usually I can go over that and kind of go, I can't think of anything. And you've seen 28 other doctors who didn't. This makes more sense again. But I understand that difficulty going there when you're a physician.
Yeah. And it's the same on the patient end because they're like, does this nervous system regulation, brain training stuff apply to me? Because I've had all of these tests and things have shown up. Like there are abnormalities in our body. I think it's Dr. Howard Schubiner that calls them normal abnormalities. Like we've all got them. Or
Right.
maybe it was Alan Gordon. I'm getting them all confused.
But Sarno was the first one to say that. This is a
okay. So,
but yeah.
okay.
And there's no such thing as
Yeah.
in fact, medical testing in general, if we take the way we determine normal, say on a blood test, everything in biology is on a bell curve. If you do a test, if you check any specific thing, you're going to find some people at the low end, some people at the high, and most people are going to be in the middle. You can draw a bell curve this is true of any blood test. But the way we determine normal, you take 10,000 healthy Army recruits and you do a blood test on them. They pass their physical, they're doing everything. They can run a mile, whatever. Let's do a blood test on these people. And then we lop off the bottom 2.5% and the top 2.5%, and we say this is normal. That's not unreasonable, but what it does mean is that 5% of all humans, of every test we do in a completely healthy person is going to read abnormal, because that's how we've set the standards. So if you do enough testing, you will find something. And it can feel actually, it can feel good to go to a doctor after you've been through the regular establishment to then go to the alternative doc who does some more tests. And then they go, oh, well, they didn't check this, that, or the other. And of course they're going to find something. So is that really the problem? My experience is that is rarely the problem. I see a ton of people. I saw a lot of people throughout my career who I was dealing with it and I didn't know what to do. And they went to alternative, some sort of, they had my blessing. I'm like, yes. And so they would come back to me maybe for a physical or for other problems. It wasn't like I was dismissive of what they were doing. I was actually supporting it. But I heard this stuff all the time, and they'd show me all the stuff they had done, and I didn't have another narrative. So I'm like, well, okay. I don't know that I ever saw them get better. A little better doing this, a little better. But now, if you have something that's getting you better, I'm not going to stop you from that. I'm not going to say this is the only thing. If I can steal one other thing from Howard, that I heard him say once. I don't know if he got this from somewhere or if he stole it, but anyway, I love this, that here's what you need to get better from these chronic, difficult conditions. You need a narrative that makes sense to you and the person you're working with. If I, as the physician, think it's this, and you as the patient think it's something else, we're probably not going to get to a good place. So let's talk about why we disagree. And if we do, good. Go do functional medicine or whatever else you want to do. The second thing you need is tools within that narrative. Okay, if that's what we think, these are the tools we're going to use, whether that's pain reprocessing or somatic tracking or EAET or getting under your hood or writing or whatever. We've got our set of tools. And then you need hope and optimism, which the medical establishment is not good at providing you when you have chronic fatigue. In fact, we do the opposite. You're going to have to learn to live with this. And then finally, we need care and compassion. And there are many doctors and other clinicians who are very good at care and compassion. There are many who aren't. But you put all four of those together, people get better. So the narrative part is very important. And if the way I always tell people, if you're listening to this stuff, I encourage you to go down your own rabbit hole with these ideas. And just look at the data that's out there, the neuroscience studies, the medical studies on this kind of stuff. And you're right, there's not a ton of them, but there's some small ones, and there are going to be more. But if you listen to me, listen to Howard, listen to whoever talks about this, watch Raelan, you hear some stories on here, and you do all that, and it doesn't make sense, it doesn't make sense for you. You have your own innate wisdom. Okay, go look for something else. I'm not opposed to that. So you'll figure it out. And so a little bit, I've gotten much better at just letting go of my need to convince somebody or my need to, I may sound passionate and evangelistic, and I am, but for any one individual, this is on you to figure out. I just know the human body's an amazing healing machine, and you can figure it out. So good for you for even keeping looking for answers.
This is incredible. I could keep you here absolutely all day. This is just every sentence has been gold. So valuable. I hope to have you back one day. I'm thinking I'm going to link, we mentioned Nicole Sachs and Dr. Howard Schubiner, who I've interviewed on the channel. So I'm going to put those both in the video description. People watching, if you haven't watched them, they are must-watch interviews. You will not regret the time spent listening to these two. And also, just for people not, if you are in that place where you're giving up on your doctor or the conventional medical system, I really urge you not to, because you do need your doctor. And there are so many more that are in the know. I can't believe how many doctors tell me that they send their patients to my channel, which I just love that humility and that openness and willing to work together. So I'll link here as well a playlist, all of medical doctors who are doing incredible work just like this. So there's a lot of reason to be hopeful. We still have a long ways to go, but wow, are we making progress?
So much. It's in such different place than 6 years ago when I switched over and said, this is all I'm going to do. We are in a way different place as far as the amount of information that's out there, and even the number of doctors who get this or even get it enough to at least suggest it. It's dramatically different. We're going in a good direction. Yeah.
If people wanted to learn more about you or connect with you, or do you have any resources, or how could people go about doing that?
Yeah, I mean, I encourage people to find my website. I teach online classes, so you don't have to come and see me, but at bouldermindbodymedicine.com. I just started fiddling around on YouTube. I have a handful of posts. I keep telling them, yeah, I'm going to do more of those. So that's at dr.fanestil. And I've got a little Instagram. Again, I just started this. I will see. I'm like, yes, I've got to get the word out. So both of those are, at dr.fanestil.
Amazing. Of course, we will have that all linked in the video description. Definitely worth checking out. So take a minute, expand the description, and just click on some of those and see what's there. Dr. Fanestil, thank you so much. This has been incredible. I could not possibly be more excited that you exist and that you have all this knowledge and that you are out there helping people and you have online resources and you have such a passion for it. It's been such a hopeless space for decades, and this lights me up. So thank you. Thank you for being here.
I'm patronizing here, but big reason is because of you. I mean, you're certainly a huge part of getting this word out here. And it's just so important because I absolutely refer people to your channel all the time and have specific videos that I've saved. And you as a patient should watch this one because this is just great stuff. It can really help to people to absorb and understand just how real this is.
Yeah. It's one thing hearing the science, and it's a whole other thing seeing the actual human beings that are recovering using these approaches. So yeah, wonderful. Well, thank you for being here. Thank you to everyone who is watching, and I hope to see you in one of these videos in this next doctor's playlist. And I mean it. Love to have you back one day, Dr. Fanestil.
Thanks a lot, Raelan.
Thanks a lot.
Bye-bye.